Hi, my name is Tim Reed and I'm managing owner of Forever Young and Trim. At Forever Young and Trim, we are here to focus on three things: health, wellness, and beauty. We do a variety of services after being in business since 2004. So we have a wide spectrum of procedures that we do in this facility, for health purposes, for weight loss, for supplementation, as well as non-invasive procedures, cosmetic, and also invasive procedures for cosmetic. So our goal is to be sort of a from tip to toe facility that will help to generate health, wellness, and beauty.
Hi, my name is Dr. Michael Rodriguez. I'm a native from South Florida. I went to high school down here. I graduated from Florida International University and subsequently from medical school at the University of Miami. I then completed a year of general surgery at the University of Miami Jackson Memorial Hospital, followed by 4 years of head and neck surgery. Subsequently, I did a fellowship in UC Irvine in Southern California, specializing in facial plastics and reconstructive surgery, and then came back to my hometown to follow up with another year of training in cosmetic surgery. In addition to specializing as a facial plastic surgeon, I've also committed 2 years to general surgery and cosmetic surgery of the body. I specifically have performed over 500 liposuctions or liposculpture procedures, including Brazilian butt lifts or gluteal fat transfers, in addition to perform lipo-abdominoplasties or tummy tucks, breast augmentations, breast lifts, or combining the procedures together and performing what we call the mommy makeover.
My consultation was a mommy makeover, my 50th birthday present to myself, because it was time for me to take care of me. I just was not happy with the way I looked. I had the muffin tops, I had the bra roll. I just was not really happy when I looked in the mirror. I feel like I'm a teenager again. I'm extremely happy with the results, and I'm really proud to go shopping for clothes and go out in public and just do my thing. For me, body image is a very important factor. If you don't feel comfortable with the way you look, you're not gonna be happy. It just helps me be a little bit more social, be a little bit more confident. Body image to me is an extremely important aspect of daily life. Exercise and diet will definitely help, but you can do all the exercise and dieting you want, but nothing will lift your breasts. The muffin tops, I found that diet and exercise, they still didn't go away. My belly fat, there were certain areas that even though I did exercise and diet, the areas that I needed targeted were not taken care of by that. My body has fluctuated. I've had 3 children. So I've had my ups, my downs, but I think when I hit 40, there were just areas that didn't satisfy me. I was not happy with the way I looked. I avoided mirrors, I avoided clothes shopping. I was not happy with the way that I looked. Dr. Rodriguez, the staff, phenomenal. I did consult other doctors prior to coming here. Dr. Rodriguez was extremely honest with me, which I appreciated. Other doctors told me what they thought I wanted to hear, and they said, no, we can do whatever it is that you want. Dr. Rodriguez set his limitations. He knew what he could do. He knew the results that he could get, and he was very open and honest with me, and that's what sold me on Dr. Rodriguez. My post-op care was phenomenal. The staff is phenomenal. They treated me like family. I do have a procedure scheduled. I am getting some facial fillers, so I 110% recommend Be Forever Trim and Dr. Rodriguez. Fear is a big factor, but I would tell them that Dr. Rodriguez is very open. He's very honest. He lays it out on the line. He tells you exactly what to expect, both pre-op and post-op. And I would just encourage them to do whatever it's gonna take to make them feel better about themselves. Everyone, they know that there's been a change. They can't really pinpoint it because Dr. Rodriguez did such a phenomenal job where my results are natural. I don't really look like I've had anything done, which is one of the benefits to me. So people, they just think I look fantastic. My husband, honestly, cannot keep his hands off of me.
A big emphasis of my practice is a relationship with my patients. I feel before entering a surgery, this is a lot like entering a marriage. And what that means is that communication is of the utmost importance. The entire part of my consultation is focused on what bothers you most. And I promise that I'll ask you several times what bothers you most. I give you your risks, benefits, and alternatives, and then allow you making a decision after only being fully informed. And I give you your treatment options after only hearing what bothers you most.
I'm a Florida girl, and I had a lot of dark discoloration on my face due to the sun and not having good skin care when I was young. So they had a procedure, the CO2 fractional laser, and that's what I was looking at doing, something to lighten the dark spots on my face. They were getting worse because there again, as you get a little bit older, the pigmentation in your skin changes a little bit too, and it just, that and that also helps with some of the fine lines and other things like that too. So it's a combination. I met with Dr. Rodriguez. He told me what they would do and what the procedure would be, and I went on ahead and that's what I did. He is definitely one that likes to know what you want and may suggest something different than what you're thinking. Like I said, I had more external things that I was looking at, but I've gotten to know him over the years too. And I think women especially critique themselves a lot. I was going through weight loss at the time, so my face changed a little bit because you lose the contours of your face a little as you lose weight and things like that too. He's great to work with. He's very thorough. He explains things very well. He's very easy to talk to. So I can certainly understand if someone's going through something a little bit more in-depth, that he takes all the time that you need in order to answer questions and discuss things and things like that. So he's a great doctor. I have been very comfortable with him. There's a machine that they use. They put a solution on your face so that you cannot feel it, and then they actually, section by section, go over your face with this machine. It's in like a little square. It's a laser. And they go down through the layers of skin, and they actually use the laser in it, and it helps with the collagen, I think, a little bit, but the main thing is the exterior surface of your skin. Once it was done, it was absolutely fabulous, and made my whole face glow because you've kind of taken off a layer of skin, and it was great. Oh, I think it gives you it refreshes you. You look in the mirror and it does definitely help with your self-confidence, and it makes you feel that you are, you just feel a little bit younger, a little bit more together. I'll continue to do it as long as I need to do it, and tweak a few things here and there if I need to. People just think you look fresh. They don't realize that you've had anything done, really, in the way of, if they ask you, they just say, you're looking good, you look healthy. I think that's probably more than anything, it's more of a healthy look because it's fresh and your skin has a nice glow to it. I think health is probably one of the primary things that you look at. I try to live healthy and eat healthy and things like that, but your skin is a reflection of all of that too. And some of the procedures that they have available, and there's a lot of different procedures available now, and they really look at what your needs are and what you're trying to achieve. And I think that and then when you look in the mirror, you feel healthier. It's kind of state of mind, I'm sure, but when you look at it and your face glows, and you know, it makes you want to continue to take care of your face and yourself. I think it makes you a little more enthusiastic about it too. I would say that first they need to determine what they're trying to achieve, because you know, if it's fine lines, if it's dark spots on their face, or if they just want to kind of have a more youthful look. Dr. Rodriguez is really good about helping you to look at the options and see what fits you, you know, in more than one way. But I tell you, nothing is better than to look in the mirror and feel good about yourself. And I think it's reflected in the way you approach people sometimes, in your attitude. So that's a real positive thing for anybody to have at any stage of their life, whether they're, you know, they're older or not. I mean, good skincare is good skincare. And, you know, they have great products available, and they help guide you with products that will help you maintain that after you've had something done too. So.
Well, we work together, Dr. Rodriguez and I work together, and I've been seeing his work, and I decided to actually do it myself and try to do lipo in my back area, and the fat that they take out, they actually do a butt lift. You start seeing, paying attention about what's happening to your body when you start aging. And when I start seeing results with other people, I just decided that it was also a good choice for me to do it. I made that choice. I asked him if that was okay. He think it was okay to do it for me. And he said, yes, of course. And he showed me different befores and afters, and definitely you can see the difference. And also because I deal and I see them coming in and out of the office, I had the opportunity to see it myself, how great results they have, and also not only in their body, but how they feel themselves. You know, they made them feel like $1,000,000. They actually changed their whole attitude changed, because they see how beautiful they look after the procedures. So that's why I decided to do it. I do work out before, and you know, I'm tiny in certain areas, but for example, on the waist, you find that you can work out and work out and work out. In certain areas, the fat is very stubborn and don't go away anywhere. So for those areas that are still there, even if you work out, you have a great body, great fit. Doing this procedure, it just accelerates the process and give you that final process of what you want to see from yourself, you know, how you want to look on the physical. Yeah, and it's something that is very easy. Example is you going in, you know, go under, and from after 1 hour, hour and a half, you're done. So it's a procedure that is very simple, and I found that the recovery also is very fast, because you don't go under, so everything is very easier right now. And you can go to work after a few days and continue your life. It was very easy. Yes, you feel some numbness in the area that has been worked, but actually in my butt, that he put the fat transfer, it wasn't difficult. It was not so uncomfortable. You just have to make sure that you don't sit and put your weight for a few days, you know, at least for 7 days directly. You put your weight, so you sit on a little donut pillow, and that helps, you know, to cushion your weight and not to damage the artwork that Dr. Rodriguez do. You're more confident, and your attitude change. You're more optimistic in life. You can approach people differently. You feel more happy with yourself. So, and when you feel more happy with yourself, you can actually spread that happiness to other people, because you feel good about you. So it's not only inside, but you also feel, you know, outside, but also helps inside, you know, because it lifts you up. It gives you a better perspective about yourself, and you can actually do that to others. So your work is easier and it's better. And any relationship that you have, it can improve with that. all the time. Oh, you look great, you look beautiful. I love it, I want to do it myself. Let me see, turn around. So sometimes I had to check, oh, nice to meet you. Let me show you. Yes, you know, you get more attention from everywhere. Yes. We have so many patients that came to have the procedure that they don't work out at all, and they look great after, you know, the final results. And also we have people who work out and they try to burn the fat in certain areas and it's not going away, so they do it because they wanted the definition in those areas. So for both of them, they work perfectly, you know, especially when you do lipo, or you want, you know, small waist, or you want like under the belly, sometimes it's just a little bump that you had there that you make ups all the time and it's just not moving. So for those reasons, you can actually do it. I will tell them that it might sounds that is a procedure that is maybe dangerous, or maybe that you will have to stay in bed. And I will say that no, that's not the case. You don't have to stay in bed. Maybe the same day that you had the procedure, only because your body needs to rest and recover. But then the following day you can actually and start doing your things, you know. Slowly you can introduce your activities, your normal activities. The procedure is much better than what it used to be, because before you go under the general anesthesia, and now you don't. So you awake while you have the procedure, and this helps a lot, because a lot of people are afraid because of that, because they don't want to be unconscious. So being conscious during the surgery, during the procedure, it helps a lot of people to feel more confident, to feel more relaxed. And it's in and out. It's just something that it doesn't take long at all. And you're aware, you know, you're aware of what's happening while they're doing it to you. So I think it does a plus. That's very, very good. Also, I didn't feel anything like after that, like feel nauseous. I didn't feel any of those things. You feel uncomfortable because, of course, you have something, you know, someone working your body, and your body's going to react a little bit. But we also promote massages, you know, the lymphatic drainage and massages to help that recovery, to help promote the healing process. And if you do it, you know, your recovery is going to be faster. The feeling in your body is going to come back faster because you feel numb after. So those feelings are going to come back faster. You're going to promote circulation with that, and so your tissue is going to recover faster. So we have certain things that you can do after to actually accelerate that process and feel free, you know, sooner. Yeah, but it's, I think it's just fantastic. Yes.
I'm a fellowship-trained specialist in facial plastic and reconstructive surgery. Very excited about our latest technique called the U-lift. After having performed over 2,000 face and neck lifts, I've come up with this proprietary lift to help enhance my results and improve downtime. That is, time to recovery before you feel comfortable with facing the public. You go home immediately after, and the recovery is within a few days. What we say over here at Forever Young and Trim is, if you give us 10 days, we give you 10 years.
I came because I needed something to improve myself. I think I was looking very old. My neck was hanging, and so they proposed to me to do my neck, my eyelids, and dead fat from my thigh and put it here. He told me that he gave me that I will look much better. He told me what I needed to do. I was planning to do the neck, but he added, you know, the eyelids and the fat here, which I think the results were fantastic. I'm very happy. And I never have any pain after the operation, not even a Tylenol. So everything was fantastic. Well, my neck was always bad because I inherited from my mother, you know. And I always heard my mother was always telling me, I'm going to save money for your neck, for the operation for your neck. So I had that always in back of my mind. So when I lost 20 pounds, my neck was even worse. So I decided to come here and see what they can do for me. Because I wasn't happy. I wouldn't wear round neck, I wouldn't wear, many things because of the neck. I was very happy. Everybody had to stop me, like, well, Lali, your retirement, you look so good, you look so relaxed. And I looked thinner, and I looked relaxed, I looked refreshed. It was a complete change. Okay, he did the neck and the eyelids, and the upper eyelids and the lower eyelids, and he took fat from my thigh and I put it here because my face was thin. I came with my husband. My husband went out to lunch because it would take a long time, and then I wake up and I was fine. I was always bandaged, and the nurse told me, well, you go home. I had a prescription for painkillers, in case that I have nausea. I didn't have to take anything like that, nothing. Well, I couldn't believe it. I went home and I lay down in bed. And then after 10 minutes, I said, what I am doing in bed, because I was feeling so good. So I got up and I sat down in front of the TV, watching TV. 2 weeks later, I was going to the party. Yeah, it was incredible. Very good, very nice. Everybody was very nice, extremely nice and helpful. And every time that I call, because I have a doubt, because they did the operation, then they do a peeling. Dr. Rodriguez does a peeling. So you have to put cream and all of that. Every time that we have a doubt, we call and they solve the problem. Very, very good. I was so happy. Yeah, I'm still very happy. Well, after me, 2 cousins came and they have it done. And one of my cousins has her son that is an anesthesiologist, and he said, I cannot believe how well you look and how good you look, and with no pain. Because that's the best part, no pain. And so I have 2 cousins and 2 or 3 friends done it because they saw me.
So I offer a wide variety of treatment options to my patient, everything from minimally invasive to full surgical options. Depending on what they're looking for, depending on downtime, cost, and other benefits, I allow patients to make an informed decision to specifically address the needs that bother them most. With facial rejuvenation, I find a lot of patients are wary of general anesthesia. For me, while general anesthesia is safe when needed, it's an unnecessary risk that's not required to undergo a face neck lift. Previously patients thought that a face neck lift would be performed under general anesthesia in an operating room for 4 hours, required some overnight admission or some observation with drains. My facelift takes 90 minutes. You're fully awake in the comfort of a dentist chair with a little bit of sedation, and you leave immediately after. If you're the first surgery of the day, you'll be having lunch at home.
The first time I came in was perhaps about a year ago, and the reason I came in was I had excessive skin in my neck. And as my wife used to tell me, she said, you have enough skin there to make 2 faces. So I said, well, maybe it's about time I look into this situation. So I came in because I was interested in the oral therapy. And so after a consultation, we went through the oral therapy, and we did get some positive results, but still, because of I had so much excessive skin, I said, I'm not 100% satisfied. So I met with Dr. Rodriguez, and he said, well, the next step, of course, is to go into a little more invasive procedure, of which I did. So on May 1st, I went through a neck lift, and here it is 6 months later, and the results, as far as I'm concerned, were very good. I have the contour again in my face, which before it was more sagging. At least now you can see my jaw again. So at this point in time, I'm very satisfied. In my meeting with him, he agreed with me that that there certainly were noticeable results with the old therapy, but that as a result of so much excess skin on my neck, the only thing he could do would be to actually do the cutting and pull and get rid of that skin, extra skin. So that's exactly what he did. But he outlined everything for me, and everything went perfectly smooth. You know, they picked me up at my house. They delivered me back to my house, and of course I had to stay, you know, for a couple days inside the house because I was bandaged. But you expect that. Being 70, although I feel like I'm 40, you know, I was giving my age away with that excess skin and with no contour in the chin and jowl area. So it was, you know, it was good for me to get it done because I felt better. And people that then, when I disappeared from the gym and from other places and I didn't see any of my friends for a while, you know, I could tell that when I did see them for the first time, they gave me a second look. Now, they didn't say too much, but one of them said to me, "Oh, I haven't seen you in a few months. You've lost some weight, huh?" You know, because he could tell my face wasn't sagging like it was before. So, and my lady friend, of course, noticed it right away that you know, that the skin was gone, so to speak. My neck was back to where it should have been, and so all in all, it was a good experience. Well, it was very important for me because in my profession, if you will, which is actually residential management, there are days when I have to meet face to face with 50 to 100 people. And when I have to conduct a meeting, a condominium board meeting, something like that, I mean, I'm meeting face to face with hundreds of people. And so that was one of my main motivations, was to you know, at least look a little bit younger and get rid of the neck, so to speak. Oh, exceptional! Yeah, it was. The prior to, they were available for anything at any time, and after, they were calling me to make sure everything was okay. And then, of course, when I came in, they had extra procedures that they wanted me to go through. You know, just I forget what it was called, but to like face massages and things like that, just to expedite the healing, and so to speak. But the staff was excellent. It's very important, especially like I say, when you're in a industry like I'm in, where you're meeting people all day long, and of course you have to play the part, because I work every day in a suit and a tie, and you have to, your face has to kind of go along with the program. If you don't, you know, the suit means nothing if your face is sagging, you look like you're 80 or 90 years old, you know. So that's one of my, like I say, primary motivations.